So if you're only missing one tooth, why a dental implant over a traditional bridge?
Well, the traditional bridges, actually, we don't really do bridges anymore. We recommend that patients don't have bridges.
So in your office, you don't like them?
No.
Oh, really? Okay.
Yeah, and actually we replace bridges with an implant. So the reason being is you have to actually destroy the two adjacent teeth to do a bridge.
What do you mean by that?
Well, in order to get the bridge to fit, you have to cut down the tooth, adjacent, both teeth. The other big issue is the bone loss. So when there's not a tooth in your mouth, your body does not know to lay down bones. So your body resorbs the bone over time. If there's an implant in there, the implant tricks the brain that it's really a tooth, and you don't lose bone there. Because if you lose bone on one tooth, it affects the adjacent teeth as well.
So you start losing more teeth, possibly?
And before you know it, it just becomes a domino effect.
So what's more expensive, the bridge or the dental implant?
They're actually very comparable, but over the long term, the implant is much less expensive because you don't have to replace it like you do with a bridge every 10 years.
So if it was somebody, a friend of yours, or somebody in your family, missing just one tooth, there's no way you would do a bridge?
Not even a question.
Really?
Not even a question.
So why doesn't everybody do it? Is it just they hear surgery and...
No, I think, if in my office they do it. I think if you go somewhere and they're not doing dental implants, then they're not going to offer it to you. But anybody who's doing dental implants knows that that's the better option.